Welcome to the Dusty Muffins, where menopause meets sisterhood and strength. We're three menopause specialists coming together to laugh, share, and empower you through the wild ride of menopause and perimenopause. Whether you're curious, confused, or just looking for real talk, you're in the right place. We're here to answer your burning questions, educate, and advocate, all with a dash of humor and a lot of heart. So pull up your chair and join the conversation. Before we dive in, please remember, while we're doctors, we're not your doctors. This podcast is for educational purposes only and is not a substitute for medical advice. We encourage you to partner with your own medical clinician to address your unique health needs. This is the Dusty Muffins.
All right, today we're thrilled to welcome one of the most passionate and powerhouse voices in menopause and sexual medicine, Dr. Kate White. Dr. White is a board-certified menopause and sexual medicine specialist with 26 years of experience caring for women in all stages of midlife.
She treats patients at Low Country OBGYN in Charleston, South Carolina, and shares her wisdom across the breadth of social media. She's made it her mission to spread evidence-based menopause care far and wide, including lecturing nationally and internationally in the checkout line at Target or anywhere there is a midlife woman.
And now she's teaming up with her husband, a marriage and family counselor, to launch a brand new podcast called Heads and Tails, focused on what really goes on in midlife relationships, hormones, and healing. We're so excited to talk about everything from hot flashes to healthy aging, hormone education, and what it's like to create a podcast with your life partner. I am Dr. Aoife O'Sullivan, a board-certified family physician and Menopause Society certified practitioner, and I see patients through my telemedicine practice here in Oregon and Washington.
I'm Dr. Rebbecca Hertel. I'm a board-certified osteopathic family medicine physician and a Menopause Society certified practitioner. I have a private telemedicine practice, and I see patients in several different states.
I'm Dr. Christine Hart Kress, a board-certified women's health nurse practitioner and menopause certified practitioner, and I see patients via telemedicine in several states as well.
Welcome to the podcast, Dr. White.
Thank you so much. You know what? You're my favorite muffins ever, even more than like a carrot cake muffin. I think you're probably right, by far my favorite muffins. And so glad to be with you, brilliant women, and be able to share this passion that we all have.
That's awesome. So is carrot cake your favorite? Otherwise?
I'd have to say, if it has a cheese icing, but otherwise it's no less.
100%. Absolutely. All right. Well, let's get into it. So, Kate, you've spent over 2 decades in the exam room with midlife women. What are the most common or maybe most surprising concerns your patient bring up about menopause and sexual health?
Oh, gosh, I think that it's the main thing that I see is it's so surprising to them. It just that it comes to them out of nowhere. We've got lots of education about, hey, your period's coming, and here's what to expect when you're expecting. But what to expect when those hot flashes start and you feel like you're losing your mind?
Yeah, I mean, even ourselves, right? I think we would all say we were shocked when it happened to us.
Mm-hmm. Absolutely.
When we finally figured it out, right?
Yeah. Do you think that's why we're all so passionate about it? Because we don't want any other woman to have to go through what we went through?
Absolutely. And not only that, do we not want them to go through what we went through as individuals, but I think that we don't want them to be in the situation that we were in as healthcare providers, completely uneducated on to how to help these people. I don't know how it was for you, but I, as going through all of that residency training, I got almost no education on menopause. Mm-hmm. If I saw someone coming in with their review of systems that had 16 things on it, and but their main complaint was, I just don't feel like myself. Well, I know how to make your uterus stop bleeding. I know how to, take care of a vulvar abscess. I don't know how to make you feel like you. And now I actually do know how to make you feel a little bit more like you, and try to help you navigate what is normal, what is not normal. But I think that was the hardest part for me, and for people who are out there and have no resources to try to figure out how to navigate the changes that they're going through with their relationships, and how it affects them in every part of their life, every relationship they have. That's my goal, and the goal of the podcast that I'm starting with my husband, because we both see it and have lived it.
Yeah.
You were probably like me when they would come in with those 16 different weirdo things, and I felt hopeless and, helpless to help them. I always said, go see your family practice and your primary care provider.
We're like,
they're going to make you feel like
And we felt the same. I would
yes.
call
Gosh.
my heart sink patients. Like, I would see their name on my schedule time after time,
and
my heart would sink because I felt so useless to them. I really feel, and this is what I teach as well when I'm teaching residents.
So
this will make your job so
with,
much easier. Knowing this information,
a little bit at a time, trying to say, I've got to be. I think that people feel like they come in and they are literally in a crisis mode. And when people say a midlife crisis, it is a crisis because they don't feel like they can act effectively in any portion of their life anymore. And I think that's not everyone's life is completely falling apart, but it's probably falling apart in one area or the other. And we try to kind of guide them that it's not a crisis. This is just a recalibration. We're going to, every one relationship you're in, your romantic, your parental, professional, even your relationship to yourself, it all feels it. And so how do we help them navigate that recalibration?
Right. So you kind of had to shift a little bit, right, of your like just traditional OBGYN practice to then encompass this section. So how did, how did you do that, or what was the easiest way, or how did you navigate that shift?
So it started off just with education a little bit at a time, trying to say, I've got to be able to help these people, and I'm not equipped. So it started off with ISWICH, which I think everybody's here is an International Society for Study of Women's Sexual Health, because I really felt like I was not getting adequate education in this area from ACOG, which is American College of Obstetricians and Gynecology. So ISWICH focuses on women's sexual health, which of course we had no education in either, really. But big part of that is hormone care, and that menopausal hormone transition is so much affected by that. So started to get off going into those educational meetings and getting education for myself that way, which is a great way for people who are practitioners to find that education that they're lacking. They do a great job there. And then I kind of got swept up into it. I don't know, some of you know that my best friend from residency is a doctor that some of you have heard of. It's Dr. Mary Claire Haver. And so she came to me when she was doing her menopause retreat for the first time. And she said, hey, I really need someone to do the sexual medicine lectures for me. And I had been going to ISWICH, and I said, I can do that. So little did I know that would start a firestorm of women's demand for more education, and swept up into really seeing the need and being very passionate about being part of that answer for people.
I think it was Dr. Haver who did a post a while ago on the American College of Obstetrics and Gynecology, their green journal, the journal that they produce. And she went through a few of them and pointed out how there were almost no articles on women in midlife. It was all gynecology and about pregnancy, and almost nothing about menopause.
Yeah, I mean, if you just try to find any research on midlife women, there's about 10% of all and there's not that much research out there for women in general. This is specific, but 10% of it is on midlife women, and it's half of our lives. Half of our lives we're spending this, and whether you're looking at how it affects our hearts in cardiology, whether it affects our bones, whether it affects, certainly, I mean, in sexual health, we have 2, 3, if you include testosterone, medications for female sexual health. How many do we have for men? Like at least 20 something. Yeah, and so if there's not the backing there of the research dollars, Yeah, it's just not going to happen. So, and the drive as we are in a tremendous position to demand that we get the attention medically and research wise that we really deserve. And I think that's fine. That forward motion is becoming from a grassroots position, but we still have a lot of, okay, what do I do right now? And how do I manage the situations that I'm in right now? I've got all these hormone shifts and I feel like that they're affecting my brain. And if you look at people like Dr. Lisa Mosconi, who is doing that research on how the hormones affect our brain, I'm sure that you guys have heard people come in and people say, really worried that they are going crazy.
Yeah.
Or they're just completely losing their mental capacity to dementia. And it's very frightening. And people will come in and they'll say, well, people tell me that this menopause changes are all in my head. I'm like, well, they're not wrong. It is in your head, right? I mean, why? That's not a wrong thing to say. There's estrogen receptors, there's progesterone receptors, and estrogen and they're all neurotransmitters, which means a neurotransmitter, it literally is what helps transmit the information to your brain, and your brain ultimately transmit that information to the rest of your body. And so to say that it's all in your head, well, yeah, and there's nothing wrong with that. So let's figure what's going on in your head.
Yeah, and it is scary.
Oh, yeah. And whatever scary. About research, we don't even have proper billing codes when it comes to women. I mean, try and find a billing code for perimenopause, but you can find a billing code for being sucked up into a jet engine. That's there. You know?
No. Yeah. From being pecked by a chicken.
There's weird. Yes.
Actually, it's funny that you say that. I actually was looking because our electronic medical record system changed some of the billing codes this past week, and I looked for a code for some in sexual medicine. One thing that can happen is actually you can have something as the hormones change, and you can get something called clitoral phimosis, which is, you all know, is where that clitoral hood becomes adherent around the clitoris, and it can really impact people's with sexual pain and clitoral pain, but also decreased sensitivity of the clitoris. So people are like, oh my God, my orgasm just went away. I don't understand what's going on. And you can see, and so there's a procedure that we can do to release that adhesion around the clitoris, and it's called clitoral phimosis. It's been known for many years. That's what you call it. And I went to find the code, which had previously been in there, and it was gone.
Wow.
They'd taken it out. I said, hey, I'm doing this procedure for this patient and that code is gone. And they're like, well, let me see if I can find something close. And I'm like, what? Yeah, guarantee you, if the code for phimosis of the penis disappeared, you would see that back there.
It would have never disappeared.
That wouldn't have happened.
Exactly. And so it is it's definitely a two-tiered system that we're trying to correct, but it's a little bit at a time. And people have to even recognize that this problem is a problem and something that can and should be corrected.
So Kate, did you, before going to Ishwish, did you do that procedure, or were you even aware of that procedure? Because I think you and I trained about the same time. And as women's health, I started my career in OBGYN residency. So I called myself the 21st resident because I was lucky enough to go to all of their lectures. And until I joined Ishwish, I had never heard of that. I'm like, do what?
Right. Honestly, we weren't even trained to really look at the clitoris or the clitoral head for sure. I mean, it was barely, it's like, oh yeah. When I talk about vaginal dryness, I think this is a very thing that I think is shifted so tremendously for me, is when we were taught about using vaginal estrogen. And I had wonderful professors, and I don't mean to say that, but it was a very misogynistic way of looking at vaginal estrogen, because we were asked, are you having any dryness with intercourse? Are you having any pain with intercourse? Which good. It's good we're asking it that at all. If they said that they were not having any vaginal dryness or pain with intercourse, then that was it. You didn't talk about vaginal estrogen anymore. And we weren't even asked to say, hey, are you having some dryness in your vulva? Is it uncomfortable when you're sitting just or walking with your friends? It was all about sexual activity. And if you were not a sexually active person, we didn't care. I mean, it wasn't, we were not taught to care. Mm-hmm. I think that now we know, oh my gosh, all these women who are leaking urine, have urinary urgency, getting up in the middle of the night, that is estrogen in your vagina. But your vagina also has the urethra and the bladder and all these areas around it. And we've got to care about it, because if you look at the admissions to hospital for women over 60, about 20-25% of those are for UTI related events. And then they can lead to mental status changes and urosepsis, and it's going to be killing them. But we were just never trained. And, we know now what we know. And we just want to make sure that women are out there advocating for themselves and saying, hey, I need my urethra to not be thin and open and letting out that bacteria in. I need it to be bulky and nice and fluffy and keeping everything fresh. Even if I'm not having a penis go in there, I need to protect myself. So, if you are having a penis go in there, then it's even better to have a little vaginal estrogen too. But, or anything go in there.
That's right. Or anything.
Yeah. You can be in good hands with your own.
That's right. That's right. Good. I like that. You're in good hands with your own hand.
Yeah.
Sometimes you're probably in better hands with your own hand.
Honestly, right. So it's about a shift of thinking, a recalibration of all of our brains, whether you're the practitioner or the patient, and looking at advocating for yourself and in your changing needs. But what else do we need to talk about today? What about your work? How about how your identity and your brain changes and everything, how you change with your relationship to work? I mean, I think all of us are at that point where we've made major shifts in our change rate.
Oh, yeah. I mean, so many women leave the workforce during this menopausal transition because, well, they first of all don't realize what's wrong. And they're completely overwhelmed. Like, that's the word you hear all the time, isn't it? Like you were saying earlier, Kate, like, I don't feel like myself. The other the really common thing is I'm overwhelmed despite everything.
I think that we would look at all different things. You've got to you're shifting your priorities from ambition to meaningful change in what you're looking for out of your career. You're navigating that job dissatisfaction and burnout from those things. And I know for me, ADD is not new to my brain, but how I'm managing it has changed tremendously. I honestly, I have a standing desk. I've always been able to manage things. And I got to the point in one of the things that really impacted me that I thought where I saw my brain is not functioning the same as when we send in controlled substances. If you have to send in pain medicines or testosterone, which that's a whole nother why it should be controlled, but whatever. That's a whole nother episode. But you have to you send it to the pharmacy, and then you have to have a 6-digit confirmation code that for that. And I could not remember 6 digits from the time I had my phone in my hand till I went to the point. And I was like, what is wrong? I am losing. I cannot even remember 6 digits to get from here to here. And so when I started increasing my hormone patch, which is what I use personally for my estradiol patch, I got to a point, and one day I was like, oh my gosh, I can remember the numbers again. And it was like magic. And I said, my brain is actually working again. I mean, and my focus, I was able to focus a little bit better. Other things, again, I still need a standing desk, man. But that ADD that increases in that menopause transition is devastating to women, especially if they have higher executive function jobs. that they feel like they are not capable. That's why they leave the work. They're like,
That's why
I
they
can't
leave.
even do this. I can't even be
Yep.
trusted to do this. I can't trust my own brain to be able to safely make this, do the things that I've been doing for years.
Mm-hmm.
Yeah, absolutely. And you're stopping in the middle of a sentence and can't
Yeah.
remember what you were going to say, or you have to make a presentation and you're so worried you will forget the words
Yep.
or have a hot flash in the middle of
Yeah.
it all. I mean, there's so many reasons for women to leave the workforce
Yeah.
around this time.
Mm-hmm.
Mine was reading. I couldn't read, and I mean, I could read,
Absorb.
but I couldn't remember. I couldn't. Yeah,
Yes.
I could not comprehend the things. I'd have to 3, 4, 5, 6 times, like my patient charts. I know we talked about that before, and you're just like, this is my life. This is my job.
Yeah,
What do
and
you
to
know?
go to that from being so amazing at multitasking and
Yep.
like just juggling all these balls always for your whole life,
Yep.
to being in a position where you can't remember. I mean, every time I put that code in now, Kate, I have the same story as you. Every time I
Yep.
put it in and I'm able to remember it, I think back, I remember what it was like not to be able to
Mm-hmm.
remember the code. And I also think like how far back that went for me. Like that's probably, you know,
Yeah.
I started hormones a few years ago, but I probably looking back, because that responded to hormone treatment, I could have probably started that 10, 15 years ago,
Mm-hmm.
which would have put me in early menopause. You know, my periods are still going, but I was starting that menopause transition really early.
Yeah, it is a when you realize how poorly you are functioning, and it
Yeah.
really it really impacts you, and how those different parts, and that lack of estrogen affects different parts of your brain. The prefrontal cortex, which is responsible for that executive functioning and the efficient use of data, and
Mm-hmm.
all those other things, and
The
all the other
cerebellum,
areas.
like your positioning in space and your
Mm-hmm.
balance. I mean, I've told the girls before, but there was one year where I broke toes 4 times. Like my brain just didn't know where I was in space, you know? Like, and I knew there was something wrong, but I just presumed it was a brain tumor. I genuinely thought I must have a brain tumor.
Mm-hmm.
This weekend I was lucky. I was with my girlfriends, and my friend said she really wanted to get. She just wants to get an MRI of her brain because she feels like she has got to. There's got to be a brain tumor or something in there. And it's like, I said, no, I think it is. It is. This is just, you need to get that balance back to get your hormone levels active in your brain again. It's a mess.
I think one thing that's been driving me a little bit crazy on social media, right? Because there's definitely this divide on social media, you know, between providers, right? The providers who will only state things if it is in the research, which we all know we haven't been doing much research. And then there is a group of providers, which I think we're all part of, that, you know, uses the research that there is available combined with the experiences of what we see in our clinical, you know, in our clinical settings, to help patients, right? Because I know just recently someone was like, no, ADHD doesn't present itself during perimenopause or menopause. You either always have it, you can't just develop it, or people who say testosterone isn't good for brain fog, even though we know it's a mood hormone. And, you know, I think all of us have seen how testosterone helps pull everything back together, but how women, once you get their estrogen at a good physiologic level, then they start to be able to function again, especially in those higher executive roles. And, you know, it really drives me crazy because if, you know, I think that's like the modern thought of menopause therapy now, right? Is, you know, taking into account what we know and trying to fill in those gaps. And I think if we're waiting for all of the research before we treat patients, then, you know, we're all going to be dead by then, right?
Yeah, or definitely not be able to get half the stuff we need to do done because we can't find it. We're like, I can't even get out the door. So I think that it is, it's looking for nuanced care is really what you have to do. Is make sure that you're being mindful of the risks and benefits and talking to your patients about their making the best decision for them, and trying to make sure that the relationship that you have with your patient is open enough that you can say, hey, this is what we know, this is what we don't know, this is what we're using, we're giving you back a hormone that you have been making and sometimes still are making in perimenopause in huge amounts. We're just trying to regulate it. We try this, and if it doesn't work for you, we try something different. But overall, we are giving patients an opportunity to try to regain some control and recalibrate where they are at this point where there's so much chaos.
So tell us, Kate, what is Heads and Tails about, and why did you decide to co-host with your husband, Jay?
Is how that impacts your job, your partner's relationship, your work relationship with your partially launched or fully launched kids, all those things. I think that and Heads and Tails is going to address just midlife relationship changes and how we can navigate those, and the things you can change and the things you can't change, and try to keep it together. I say, Jay, with marriages, we definitely see that there are divorce rates for all relationships throughout their span. But but once we get to that midlife, as Jay will say, he has seen there's a lot more. All of a sudden, it spikes it's pretty even, men and women coming to file for a divorce until you get to this age, the 40s to 50s, and a tremendous spike in women seeking divorce. And so why is that? What does that change? And as we've talked about, I said, I can tell you what the change is you've got brain changes that make you less tolerant, and you start reevaluating what your priorities are for yourself. And so that he's always been extremely supportive. He's been through OBGYN residency and good friends with all of my friends who are doing this. And so he's a little bit of a show pony anyway. So he was a magician in Las Vegas. And so he doesn't mind being on the stage, and so he says he's got 1,000 hobbies, none of which make any money. So he's a musician and a magician, and so he's actually highly entertaining for me. Thank goodness. Yeah, that's part.
That's awesome. I love it.
So he is. But he also brings the perspective of he's not educated in menopause. He's only educated by being in the vortex of all this conversation for so many years, and really seeing these changes that I come home and I'm like, of course, you won't believe I talked to this person today. So that's the kind of, and so I think it brings in a unique perspective because we've been through these changes. He's seen me navigating these changes, but he's also helped, thousands of couples through the same type of transitions.
Is that how you met him, Kate? Did he get you up on the stage in one of his magic tricks?
Yeah, well, he put me in that box, cut me in half, and then he's like, "If you want to be put back together, you better say yes." So that was it.
Oh my goodness.
I guess that's what I do. We actually met. We met. I was 18. It was the summer between high school and college, but we didn't date that whole time. So, yeah.
Oh my goodness. Are there any topics that you're excited or maybe even topics that you're nervous to dig into together?
Yeah, so I think that one of the ones that we really want to look at is the changing needs that you have in terms of communicating there's the changing sexual function, and how part of that is communication, and not just communication of how your changing needs are and the changes that we have physically, but also that sexuality is a form of communication. And so, and that is a big thing that changes. And if you weren't communicating well before all these changes happened, then there certainly are things that you're going to have to work on extra hard to try to get that communication reestablished, and try to reevaluate, because it's such a, they've got so many changes going on at once, and if you're also navigating the changes in your job and dealing with children, and certainly many of us also with our parents and the physical and emotional needs that they have at this stage. It's a lot to try to bring balance and harmony into this evolution, and so we've got lots. I feel like we've got lots of different points to meet on of these different relationships, and I feel like women are excited to hear about it, because they're like, yes, me too. I'm dealing with the same things, and they're like, I don't even like my dog that much anymore. I mean, sometimes they're like, this just seems like a lot to deal with.
They breathe loud. They snore at night.
You're not that cute anymore.
And when you bring it up, women are willing to talk about it. Like, they want to talk about it. Even when you go to a party or you're out for drinks or something with friends, women are totally ready to talk about it. Like, if we ask them in the office, if we ask our patients, they'll tell us. We just have to make sure we ask them, because they won't volunteer that information, right?
No, and honestly, for the most part, we aren't given in our current platform of most medical care. We're not given the time to talk to people about it, and it's like the last thing, like, don't bring. Oh, let's hope she doesn't bring any of that up.
No.
Right.
Yeah, because it is hard, and it's trying to find the right format and the right outlet to try to get the information to women, because in the 15-minute allotment, which is frequently double booked, so you actually have 7.5 minutes to talk about and do their exam and all that. It's really hard, and it's not fair. And hopefully by educating, not having good therapists like marriage and family counselors, and that are helpful, and they can say, hey, this sounds like maybe it's something I have the time to talk to, but maybe I can be able to help you guide you to the right person to talk to. Maybe you need to talk about hormones to your without blaming everything in their relationship on her and saying this is your problem and it's your hormones, because that certainly is not. It's a recalibration of everyone's midlife, and men have that recalibration too, and their relationship to their jobs. And don't make it get way. We have a whole episode is going to be about retirement and how the changes of your relationship in when one or both partners retires, and now they have to reevaluate who they are in relationship to their personal identity. But as one of my friends, I love that we were talking. I have a game group of girls that I they were called Game Gals, and we get together and play games and talk about our lives. And she said her husband recently retired, and she had to remind him that she was not his employee, and because he's used to having lots of people that he gets to boss around all day, and she's like, yeah, and I'm not one of them. And so I have my own set of things going on. So if you want somebody to come help you move this lawnmower into your car, and it's right when I'm supposed to be leaving the house, I am not going to stop and help you leave your lawnmower, even though my stopping to help you stop what I'm doing and help you move this lawnmower is a way that you feel loved. I am going to have to, we're going to have to figure out another way for me to show my love for you, because it's one of those stages where it's like, well, if you're not paying attention to me, that in the way that I feel like I need that attention, it feels like you don't love me. And it's like, I don't love you, but I do have an appointment, and I cannot get back in to get my hair cut. And if I don't get this appointment, it's going to be 6 weeks. I like rebook that. So it is a whole different way of feeling relationship and fulfilling each other's needs. in your love and your heart, but also and sexually, but like every aspect of your relationship.
Yeah. Something you brought up there is really important. I'd love for our listeners to know, anyone who's not in medicine, when you see your doctor, the chances are they have somewhere between 7.5 and 15 minutes to spend with you. But there's a note that has to be done, which takes somewhere between 5 and 10 minutes. There are prescriptions that have to be done, and sometimes referrals or, orders for x-rays or blood work. And somehow you are supposed to do that 30 minutes or more of work in that 7.5 minutes. I mean, it's like going to your hairdresser and saying, I'd like my roots done. You've got 7.5 minutes. I mean, it's just insane how we've allowed this to happen. But that is the current scenario. So when you go in, it's good to know that,
Mm-hmm. And it's not fair to patients. I mean, they're not responsible for how much or how little time that we've been allotted. But it is, and I don't have the perfect answer, but knowing that you want to come in and have a specific problem focused exam or time, and realizing that even if you have that problem focused time, it's probably going to be 15 minutes or really 10 minutes. That unfortunately, that's kind of how we're set up. And it's not ideal. And I will tell you, it is amazing. I know you guys have all done it. We can get a shitload done in that 10 minutes. I mean, it's amazing that really how much we can get done. Is that I don't know. And yes, there are different ways there are different platforms and there are different, there are people that have great, more flexible schedules, but it's not accessible to everyone. I mean, there are places where you can do it, have visits that are not restricted by insurance, and unfortunately, that's the case. And you may need to, certainly, you should seek out somebody who is menopause. A modern menopause provider, I would say, right? Contemporarily educated in menopause. And there are ways to find that more. There are people that are affiliated with the Menopause Society, but also with ISWICH, as we said, International Society for Study of Women's Sexual Health, which is the longest name ever. But those are going to be providers or practitioners that that have sought out on their own, outside of any there's the word. See if it's gone.
Don't worry.
Outside any demands of their demanded certification by American College of Obstetrics and Gynecology or American College of Family Practitioners, they've said, this is important enough to me that I want to go out and get the current and up-to-date information. So those are good places to start. But also, if you may need to, say, go outside of the traditional medical care, and you may be finding someone who will be able to provide longer appointments and more in-depth, especially if you have complicated medical problems that would make providing that care a little bit more difficult.
With all the training that you've done through ISWICH, Kate, when you see your patients, is there one particular myth that you find yourself busting over and over again with regards to women's sexual health, say, or one that you prefer to bust?
Oh, sure. I think that one of the myths that it just is normal and you should be able, it should just happen. Like sexual relationship should continue to be exactly what it was, and there's no need to change and evolve in your communication, so there's a lot of that we should have spontaneous desire at the same level that we did when we first met, and where everything else in our life has changed. Everything is changing. There's a lot of hormone changes, and we should just that your sexual life and your sexual function and your relationship to your partner should be exactly the same. And that if you don't have spontaneous desire, it means that you're broken. And you are, as Kelly Casperson, of course, is one of our dear friends and colleagues, and looking at sexual medicine. If you haven't heard her podcast, You Are Not Broken, it is an amazing resource. But your libido isn't a fixed thing. It's responsive, and they've got it's impacted by all kinds of different things. That sex is communication. You have to, and your hormones that are communicating with your brain, but also your communication with your partner and all the outside stresses, that you have to have an ongoing dialogue to try to maintain that. But also, you've got intimacy is a big part of your relationship and a big part of sex. And so sex doesn't exist in a bubble in your bedroom. Intimacy has to have attention throughout the day. And that sort of emotional intimacy, as well as has to be part of physical intimacy. You can't really dissociate them. So that's one of the things. Sorry, that was a very long way.
No, it's a great answer.
Things are changing, and you have to be willing to change with them, and realize that it's not automatic, and it's going to require a little maintenance, just like everything at this point.
Yeah, I think that's a good point for both, women and partners in general, right? So as women are navigating this, but then their partners, they are always asking, what can I do to help? And I think sometimes just understanding that, your partner is also changing. If you have a male partner, they're changing in midlife as well. And so it's part of the change together. And, maybe it should be a prereq, like this midlife therapy, like, how to navigate your relationship in midlife.
Yeah.
I think it should be a requirement for sure.
Yeah.
Don't you?
Or you turn, 35 and you get sent a copy of Kelly Casperson's book.
Yeah. I tell my patients all
and
the
a tube
time,
of vaginal estrogen.
Yes, 100%. And some Uber lube.
Maybe about better.
There's countries
Or
where
two.
when you're pregnant, you receive in the mail from the government this beautiful box, and it's quite large, and it's packed with diapers and baby clothes and safe shampoo and all these things. And then you can use the box itself as a little bassinet. And that's all provided by people paying taxes, and that comes out of government funds. And I genuinely think we should be sent our vaginal estrogen, and You Are Not Broken, by the age of 35, to every woman.
Some vibrators.
Everyone with ovaries.
Oh, that's a great idea. We should design that box. All the things that would be in that box. That would be a good Instagram.
It's your midlife care package.
Yeah.
Your midlife glow up.
What do you want to see in this? The glow up. Yeah. Exactly. Yeah. Little vajazzling.
Yes, vajazzling. Yes.
Yeah.
It's not just sparkles.
That's right. Exactly. So I think that is I think that those are the changes that I think would be that the myth is that it's not automatic. And all the things that you have to do to maintain your bones, and I know we'll put one more thing on the list, but it is not automatic, and it does require a little bit of maintenance. And I think that that's one of the good things that will be in the part of that podcast is, Jay is a dude. He said, I'm going to ask all the dude questions to help. He wants it to be something that both partners will listen to as they're riding down the road and be happy to be listening to it together, and be like, have guys be like, oh, I had that question too, and I need to know, I want to know how to make this, because I think for the most part, people want to make their relationships better. That's why they're in a relationship, is they want to get make it stronger and make it better, and so he's going to be there to ask those questions that all those guys are thinking, but they're a little afraid to ask.
That's awesome. So you're a doctor, a speaker, mom of two, and now a podcaster. Do you embrace the beautiful chaos, or do you feel like you're losing your marbles like we do? On most days?
ask me, day to day. I mean, I like say, I with my friends, and we're all this weekend, and we're all at different phases. One of them just sold her company. Another one is, full on, just had has two that are one's working, one's just got out of college and trying to figure out that transition. Like she's like owns her own business, and is she going to expand? Is she going to sell? Is she going to bring our partner? All these things while trying to make sure that their kids are good and all that. And then then we have friends who have they've been on their own path, and they are they're single, and they have always been single, and they're good with that, but they're also trying to navigate those changes for themselves and what their direction is. And so it's not just people that are in coupled relationships. There's the relationship to yourself that's changing, and how you feel about yourself and where you're going. And I mean, it's not just that. And they have all the same relationships that with their parents and with their friends, and it's all these changes that we're all navigating day to day. And do I feel like I'm managing the chaos? Yeah, I would say some days better than others, but again, it's this having the support and knowing that there are people out there that are, I mean, the supportive group that I have is amazing, and I couldn't do it without them. And I feel like there are a lot of people that are doing it without any support. And so if we can be that for them, then I would be really happy.
So, Kate, if you could leave our listeners with one message about navigating menopause, intimacy, or relationships in midlife, what would it be?
I would say that you really need to think of it as the recalibration. It may be a little bit off, but you just got to recalibrate and re-examine how to get back on track. But it's actually not broken. It's just a little off track, and we can get there and help to navigate how to recalibrate those relationships to be able to enjoy that the fruits of everything that's come from all the hard work and everything we put into it so far. It's worth it, and try to get there.
That's a nice way to wrap up. Thank you so much for being here with us today, Kate.
Thank you for doing what you're doing.
Yeah, it's been such a pleasure. And I was just about to say thank you for all the hard work that you're doing with all the women that you take care of. And I was going to let people know how to find you. So you're on Instagram and TikTok as Dr. Kate White, OBGYN. Your practice is Low Country OBGYN in Charleston, South Carolina. And your new podcast, which is coming out soon, is going to be called Heads and Tails.
Heads and Tails, correct. All right.
When is that coming out?
June, we believe. June. So it will drop, and I'll have it out there. Yeah.
Well, you've already got 3 listeners. Don't worry.
Mm-hmm.
We're all...
You got it. Oh, my husband, I'm sure our husbands, I would assume too, at least mine, he likes that kind of stuff.
Oh, definitely. At least 6. And then we'll get Erin, our producer here, listening as
right.
well. Yeah.
I'm like +7 already just today. That's awesome.
Yeah. Sign us up. And to all our Dusty Muffins out there, share this with your midlife besties, subscribe, and leave us a review. We're here for the laughs, the learning, and the liberation that midlife brings.